Well, hey everyone, Gillan here with the brokerage. I'm joined by our Executive Vice President, Josh Slattery, and our special guest today, John Greene. Obviously, we just finished up an election, and that has implications for our industry. So the purpose of today is not to be partisan or be political, but rather just to say, now that we know the next administration is starting here pretty soon, what might that look like for our industry? So John, to start off, if you don't mind, for those that don't know you, maybe do a quick intro.
Well, thank you. So I was Senior Vice President at the National Association of Benefits and Insurance Professionals up until June. And now I am on my own at Tri-Bridge Resolution LLC. But I have every intention of remaining in the Medicare space. And I've been following the chaos and the stories from hearing from agents all over the country about, and FMOs about how this AEP is going so far. And to your point, the election really does present some opportunities for us, and I look forward to talking about that.
Great. Well, Josh, you want to kick us off?
Yeah. Thanks, Gillan. And John, just thrilled to be here with you. Always fun to chat about Medicare. And, this year definitely is bringing a lot of thunder. We know that the IRA just had tremendous implications this year to our business. We're grappling now with non-commissionable plans. Carriers are suppressing plans. We know that, the consumer is going through a lot of shopping this year. We have ANOX that hit and prescription drug plans now. We're seeing shifts in formularies. We're seeing deductibles. We're seeing a lot of confusion in the marketplace. But we got some good news with the election in terms of, we saw healthcare stocks surge the day after. And, our business is heavily impacted by policy. And there seems to be favorable policy ahead with Trump as a president-elect and how that might impact these health insurance companies. Certainly Wall Street noticed, and we've even seen headlines that point to, this bullish outlook for the insurers now that there could be some favorable policies for Medicare Advantage. What's your take on the changes ahead? What should we be looking out for in terms of Trump's position on MA and some of the turmoil that we're all looking at, both on the agent side and the consumer side?
Well, first of all, we know what that might look like since we've had a Trump administration not long ago. And what Wall Street understands is that the president and his administration will be replacing hundreds of political appointees in all the federal agencies. And healthcare has been highly disruptive over the past few years. We've been drinking from a fire hose every year with significant regulations. And, the whole ecosystem has been turned upside down, as you aptly described the AEP so far. And so basically, all these new appointees will chart a new course for the people at CMS in terms of regulations. And so basically, we'll see it slow down considerably. And I think evaluate these rules that have been done during the current administration. And I think there's opportunities to roll a number of these back. So specifically, I think some of the low-hanging fruit include call recordings, disclaimers, a scope of appointment. I don't see how any of those add value to the beneficiary experience. And then there are a host of others that, as the administration moves forward, we can discuss. I think chief among those is agent commissions based on the date of the beneficiary's birthday on first year commission. I don't see how that's helpful in the least. It doesn't add to the beneficiary. It doesn't save them any money per se. And it's a hassle if you're born late in the year. I mean, these things are just ridiculous, and they were never discussed with the agent community. I think formation of a Medicare advisory group, similar to what we have in the marketplace, the ACA marketplace, sort of an advisory group, is essential to for the Medicare program, so that they can understand the issues and we can identify problems and we can have a discussion about what we're seeing and what they're seeing. And I think it helps shape reasonable regulations going forward. So I think there's lots of opportunities.
Yeah, you're normally this time of year, we're all preparing for a proposed rule. And given the proposed rule from 2023, moving into 2024, it shattered a lot of, of investment, of just appetite in our business, because, our livelihoods were certainly threatened by changes in compensation, a lot of just negativity towards Medicare Advantage coming out of Congress and CMS. So, how do you see some of this changing ahead? We know that there has to be a proposed rule probably introduced, but it could be meaningful, right? Or it could be not meaningful at all, given the new presidency. So do you expect a proposed rule anytime soon? Do you think that's being delayed? There was a notion it was going to come out earlier this year. Perhaps some things have changed given the environment.
Well, it's still at OMB, the proposed rule, but I think that it's going to be more technical. And the reason why is that the lawsuit really put a kibosh on doing anything big. And CMS knows it. In fact, I know that they tried to settle and that was rejected. And so they're not going to be able to do a whole lot of mischief this time around, if you will. And so I don't expect anything more harm by the next AEP, but there's a possibility of some relief before the next AEP with the incoming administration. And because they've done this before, I don't see why we couldn't push that process along in time to stabilize this marketplace and the beneficiary experience for the next AEP.
So let's get a little bit deeper now into, potential policy changes under Trump administration. So the first note we had discussed prior to recording was the Inflation Reduction Act. Let's dive into that a little bit.
Well, sure. So we flagged a number of things very early on that we didn't think would work, and lo and behold, they don't. And so whether you're a Republican or a Democrat, you know that it's not working, right? That's evidenced by the very late announcement of the demonstration to plug that premium gap effect. And that's, I'm not even sure that it was legal to do that. So we need to revisit this law and the underpinnings and some of these provisions, namely the $2,000 deductible cap. And let's be honest about, you can't give more benefits without anticipating, higher costs. So this was the last bill that was done by Congress during COVID. And so there were no stakeholder involvement, outside feedback. It was done in a back room, basically, and it was only done by Democrats. If this is going to work or have any hope of working, we're going to have to it's going to have Republican input. And so I think there are a number of these sticking areas that they'll have to revisit. So besides the cap, I think this issue of allowing patients to request smoothing payment plans on drugs is problematic, to say the least. Recent conversations with carriers suggests a lot of nervousness. They're not even sure. They have some thoughts on it, but nothing concrete on actually how this will work. I keep coming back to what happens in the 12th month of the plan year and a $500 bill for a drug that they want to spread out. How does that work exactly? Who's on the hook? There's no easy door here for fixing this. Is it the government? Is it, Social Security, coming out of your Social Security check, the repayment plan? Who knows? It's going to create a lot more unhappiness. And so I think that needs to be revisited. I think it was well intentioned. We know that the cost of drugs is very high and a real burden, but this wasn't a solution, really. So those are the two biggest things I think about the IRA. I think the other issues are more problematic and bigger in terms of what the IRA did, like negotiating drug prices and that. But I think that for our purposes, those are two issues that we're going to be confronting every day.
And John, it seems that legislation will be required to remedy some of the IRA, with the election also resulting in both the Senate and the House being dominated by the Republicans. How favorable is it that we see legislation in 2025 that could remedy this, or are we kind of stuck with this for another year or two while the Trump team kind of works on this piece of legislation?
So I think this is kind of an immediate problem that will need to be addressed early. The margins in the House still will be extremely tight. There still could be some of that tension still in the House between factions on the Republican side. So it's hard to say. But I do know who some of the committee chairmen are or will be, I believe, and they're going to be good. And so, and the Senate has a little breathing room. The Republicans have some breathing room in terms of their number within the committees. They'll be more Republican leaning, and they'll be able to act. Chairman Wyden he'll be chairman. He'll be ranking member. So the agenda will be set by the Republicans. And I think that this is ripe for them to address early.
Well, John, we know that, prescription drugs has been a big headline this year. A lot of beneficiaries are looking at changes in their formularies. We know that it's driving a lot of shopping. It's driving a lot of concern. How do you see prescription drugs being changed by President-elect? We know that there's a lot of negotiating happening now. There's 10 drugs that will hit the negotiated list next year. What's odd about the list of those 10 drugs is that a lot of them are actually coming up for patent expiration. So there may be generics that come out that really counteract the effectiveness of this. We know drugs like Eliquis, Xarelto, Januvia, some of these really popular brand name drugs are on the list. But certainly it stifles some of the investment in R&D appetite from the manufacturers. There's now some chess games going on with rebates. So this really, while it's intended to help the consumer, in a lot of cases, we're seeing less drugs, more favorable formulary selection for the manufacturers, not necessarily the consumer. So what's your take on the path ahead in regards to prescription drugs?
So Republicans generally are free market animals, right? Let the market decide, as you said, Josh, allow generics to come, help lower the price. Because sometimes when you set a price like on insulin at $30, I know a lot of employers offer it at less than that. So if you set it at 30 and the price could potentially be 20 or 25, right? You want an act of Congress every time to chase the market. However, President Trump is rather interesting in this area, I think, because he likes transparency. I think he's actually said that he'll look at European countries and what their lowest price is. So he might have come at it in a different way. So he's not a pure market guy. And so it's kind of a wild card as to how he might modify that. But I think that the choice right now at setting prices is the worst option in that regard. I think there could be more seeking to use more transparency tools to leverage lower prices through PBM reform. That's a hot topic on the Hill. There's some nuanced differences between the House and the Senate. I think one is more restrictive than the other. And some unspecified mechanism with regard to pharma. Right now, the total focus has been on PBMs. They've been masterful in deflecting away from themselves and focusing on PBMs. But even if you did all that, you're giving a clear path to pharma to rule the rules of the road, right? And they can do whatever they want. Mm-hmm. And so they're going to have to pay some price in all of this. And I think that's a longer term game, because it's, you're talking about very powerful stakeholders here who have a lot of clout, and they'll drag things out. And I think that something of this magnitude deserves to be well vetted. We've gotten into a habit legislatively of doing things very quickly without due consideration. It took, when we did Hatch-Waxman patent reform, it took us 2 years to do it. There were lots of hearings and lots of back and forth. And you end up with a better product that way, and you get bipartisan buy-in. And like I said, the margins will still be close. So you're going to need buy-in. And if you want things to last and stand the test of time, that's the route you have to take. Doing something quick just to do it is, I think, inadvisable. The last thing I'll mention, and this is part I would put under prescription drugs, is this issue that we're experiencing right now in Part D and Medicare. And the fact that come January, if they're in the wrong plan, the only way to get out of that plan is to complain to Medicare that their agent screwed up, basically. And that's not a solution. They should have an OEP. That consumer protection that we, people in Part C enjoy, that we got restored in 2016 under the Cures Act, has worked beautifully. It had support from the Medicare Rights Center. And, so we had lots of left-leaning support. It's worked great. Why not extend that consumer protection to Part D beneficiaries? They're going to need it. And I know that NABIP is still working on that after I left. It was a big goal of mine to get that done. It's hard to say if that could be a lame duck component of, what happens in the end of the year. I think because of the way the election turned out, it's going to be lame. There's not going to be a whole lot other than what they have to do, because now that they have the prospect of controlling all the levers of government, they may want to just call it a day. And when they have control, do it the way they want to. But this Part D OEP is so, middle of the road, right? It doesn't offend anyone. And so I don't know why they couldn't slip that kind of thing in at the end of the year. It's not controversial at all.
No.
Right?
Yeah. It's an unintended consequence, right? I mean, it almost feels like it was left out when the OEP was being brought back, as you mentioned, in 2016. And then this year, the year where perhaps some standalone Part D consumers, and just to be clear, your Medicare Advantage beneficiaries can still change during the OEP to a like plan, but your standalone Part D beneficiaries cannot. So if they got their ANOC in September, they saw a slight premium increase, but they didn't take the time to really dive into that formulary. they show up to the pharmacy in January, and now the Eliquis they took that was a $50 copay is now a $200 coinsurance. There's big sticker shock. They don't have the ability to move. And that's problematic. And hopefully that is something that we can see fixed, because we're certainly going to see an uproar this year from beneficiaries.
The trick on that will be to get legislation written. And it's not hard because we have the template from the Part C, and it just requires some language modification to make it mirror what we've done. And I've spoken to CMS about this, and they said that they can literally flip a switch to make it work in time for next year. So that won't be a problem. So it's just going to be whether there's will on the Hill to do it. But I appreciate you bringing that up.
Yeah, and we know that generally in a Democratic-led presidency, we see favorable policy towards ACA, unfavorable policy towards Medicare Advantage, and then that flips, right? In a Republican presidency, generally speaking, we see favorable policy towards MA, unfavorable policy towards the ACA. So as we segue into our next topic, let's talk about the ACA marketplace, and how do you foresee there being changes ahead with the change of the administration?
Well, the fight over the additional premium support that was included in the Inflation Reduction Act that expires at the end of 2025 has already begun. But this election really turns it on its head, as you said. And Republicans are adamantly against extending that. It's $300 billion over 10. So it's very expensive to do. And, there's always been this issue of benefit creep, that once you do something, just as you've seen with drug negotiation, where the Democratic nominee was talking about expanding that space to other drugs quickly, so we have premium support increasing. So I would not expect that to stay in place. So if you're in that market, tuck that away. They would likely eliminate funding for navigators. This program has been controversial from the start. It's expensive and doesn't really add any value. In fact, I know a number of times in committee hearings it's come up what the ROI is on that, and it's really small. It's philosophical. It's political. That they're in there in the first place. Agents fill that hole very nicely. There are places or times when navigators have been useful in pulling together hard to reach folks and bringing them to a broker, but that isn't true everywhere. And so I think that's likely to be on the chopping block and a pay for something else.
Yeah, I recall in the first term of Trump, he always claimed to save the ACA, right? He felt like he was handed something that needed improvement. And then now in the Biden administration, we certainly saw with the open SEPs, that market really thrive. I think what the brokers are searching for in the ACA marketplace today is stability in rates. And, some I think more competitors, more favorable actuarial models has allowed for that. But it still is a very turbulent marketplace. And certainly we hope to see that continue to improve, because for us, it's been great, for agents out there, complementing your Medicare with ACA, certainly with the turbulence we faced this last year and the fear that the commissions on the Medicare Advantage plans could be threatened. ACA was a great filler. So we have a lot of agents today that are really involved in the ACA marketplace. And I think it's, going to be an incredible ride ahead as we see it evolve.
Yeah, the last thing in the market place that I think will change is how the treatment of short-term limited duration plans. This has been a ping pong ball. Under President Obama, it was highly restricted. Under Trump, it was widened considerably. And then President Biden shrunk it again. And I think it'll be widened again. I think that Obama and Biden's time durations were too short, and I think Trump's are frankly too wide. Somewhere in the middle is probably a good resting place. And maybe if they land there, they'll leave it alone going forward. And so, this is another opportunity for the new Trump administration to land in a good place that, sticks. I mentioned transparency earlier, and the president-elect's interest in transparency. You know that in his first administration, he did an executive order on hospital transparency. And we all know that where the real cost pressure is on hospitals.
Yeah.
And, even despite the executive order and rules for transparency, hospitals have largely ignored it. And so I think that he'll add some teeth to this through legislation, and then that has the force of law. And so I would look for this administration to pursue that.
And just to be clear on transparency, basically what happened is an executive order, as you mentioned, was passed. It requires hospitals now to be very clear and concise about the rates for services, and they have to display those online in a consumer-friendly format. And I even understand CMS has secret shoppers kind of auditing some of these hospitals and actually having fines out there if they don't comply. So you're saying that there's going to be more teeth, more oversight in this in the future?
I think there will be. And I'm not saying that it's easy. I think that there are so many factors that go into what that published price is online. It's very complicated.
Yeah.
I once had a conversation with Chip Kahn about this, and he heads the hospital association. I said, well, what if you set up goalposts and you said it could be for a typical 55-year-old hip replacement, between here and here? Well, I don't know that we're ready for that, he said. He'll never be ready for that. So unless you pursue it legislatively, it's not likely to happen. And they are another, again, powerful lobby in Washington. Every member of Congress has a hospital in its district. And in many places, it's the biggest employer. So while this all sounds good, when you call up on the phone the congressman, you have his direct line and you say, this is a disaster for us. We'll have to lay off people. Oh, well, I can't support that. So it's not going to be easy. And again, this one, I think, will require a bit of time, legislative time, hearings, and vetting before it can be passed. But I just look to see the president sending that signal that he wants to do something more in this space.
That point about some of these Congress people, that's the major employer in their district. I'd never considered that being part of the problem, but that makes total sense, especially rural counties and areas like that.
Oh, yeah, 100%. And they're the ones that cry the loudest. And the hospital association uses the rural argument to mask even what their larger hospitals are seeking. They'll say, well, our rural hospitals will be, crushed by this. When in fact, we know there's ways to work around this. Sometimes the savings are such that you could transfer some of those savings back into rural hospitals to help keep them whole and to put them, not put them on a cliff.
You had also put a note about surprise billing, and that kind of goes with this a little bit. Talk to us about that.
Sure. Well, and being in Texas, that's sort of ground zero for surprise billing issues, and where the doctors have been very effective there in bringing suits against the law. And I admit I worked on surprise billing legislation for a couple of years. This one is one of those that did take some time to sort out because of the power brokers involved in this issue. I think that some of the things that doctors said they wanted, they won in final legislation, and now they're arguing that it's hurting them. So I could see this coming back to the table for some modification. I'm not saying I like it, but I think that's a reality that sometimes you have to let things settle out a little bit more. I think the agency has done a pretty good job on the whole of rolling this law out. And there were some bumps, but they were included in every conversation. All sides were on how to, mitigate or address the issues that were raised. Doctors were submitting claims for Medicaid. Well, that's, or for plans that didn't qualify. And then they want to bundle them. And so there are some issues that need to be sorted. And whether it requires legislation or not, it's hard to say. But you might see this law reopened.
And then with surprise billing, it's really the ERs that, they really identify in that rule, correct? It's the, emergency rooms. And then you also have in cases where there's non-network providers that are in network facilities. I think those were the two main provisions targeted in surprise billing. So it seems like that's where beneficiaries are feeling the pain the most when they get these bills that they just weren't aware of, particularly, limiting their access to emergency rooms. We don't want to go to the emergency room. We're going to end up with all these bills that we can't afford.
Or if you're having a baby and you don't have control over who your anesthesiologist is. And so this is another practice group where this practice has been particularly egregious because you don't have control of whether or not you have an in-network. You can do everything right. You can make sure you have an in-network hospital, in-network doctor, but guess what? The anesthesiologist on call that day is out of network.
Yeah.
And so that's why legislation was necessary in the first place. And then, not to mention, air transport, and that's still working its way through review of whether more needs to be done in that space.
John, a little off topic, but I wanted to ask you about the stay that occurred in the North Texas courts earlier this year. And we know that will be revisited next year. How exactly could that impact some of the changes that were outlined in terms of compensation in the final rule? How do you see that timeline progressing now, and especially weighing in the change in the presidency?
So the things that we cared about most as agents and FMOs, a lot of things were stayed, meaning that CMS can't proceed with the rule. And the timeline for it still working its way through the court is longer. So it'll go into next year. So that's why don't expect any changes to next year's AEP, because the timelines aren't going to work in favor of CMS. And who knows, maybe the new administration even says, you know what, we're getting out of it. We're going to pull the rule. I think that's a distinct possibility, that the Trump administration comes in and says, you know what, that was a bad rule. We're going to pull it. And so that might unwind this faster than the court.
Well, I know there's a lot of eyes on that, and certainly, it impacted agents too, right? With an extra $100 potentially, and I think that there's some question is will that be the direction ahead? Will there be further discussions about compensation? Should agents kind of keep an eye out for that? Or will this just kind of fizzle out now that there's been leadership changes?
Yeah, I would just say quickly with regard to what's happening this year and the non-commissionable products that are cropping up, or paper apps that are, this is an ecosystem problem, and it's a lot of different variables all coming together at the same time. And I don't think that this situation will last. I think it's unique, hopefully, to this year. If things, progress as I think they will, this will be a blip more than anything with regard to that issue. I think that the carriers are in a horrible place, as much as agents are in a horrible place. And it's unsettling for everybody. No one's happy. The carriers are unhappy. FMOs are unhappy. Agents are unhappy. But we knew going in it was going to be like this for the most part. We didn't know exactly how it would unfold, and we didn't know about the demonstration project. And, we didn't know about paper apps, and, we have all these rollout sessions, and my God, we didn't know it would be like this, did we? We weren't told about these things. And so it's an evolving situation, which again speaks to why it needs to be addressed afterward. But I think that there's a lot of hope, and truly that I think the president can pull this rule. They'll revisit the IRA, and they'll fix some of these things, and we'll get rid of, I hope, some of these other things that I mentioned by new rule.
I think hope is a good way to wrap this up. What do you say?
We did get HSA reform passed in the Ways and Means Committee this year. Unfortunately, the Senate wasn't ready to take it. But if we have all three levers of government, I think HSA reform is quite possible. And for Medicare patient or beneficiaries to be able to contribute to their HSA beyond 65 would be a huge help. And allowing direct primary care arrangements to use it, maybe legislating additions to the 213D IRS list of uses for HSAs could be done by the committee. And so I think there's some opportunities in that regard.
Well, John, we want to say thank you so much for joining us on the podcast today, bringing all this information. Where can people learn more about your services?
Well, I have a website, and I'll share it with you, and you can feel free to spread the word for me.
Yeah,
it's very much appreciated. And I really look forward again, to staying connected in the Medicare space. I may be doing other things, but this has always been my favorite space to work in.
Well, you're always a wealth of information, John. Certainly appreciate it, and look forward to connecting with you again, as we know there's plenty of news to outline ahead.
There is, Josh, and I appreciate this opportunity very much. Thank you.